I get this question a lot. Is hair transplantation permanent? And I say yes. As we age, there is a natural process of hair to just naturally thin, and that can improve the permanent hair, which is in kind of the sides and back of the head, or if we move hair from the beard, chest, or abdomen, which we often do. So the permanent nature of this is the fact that these hairs that we're moving are not affected by something called dihydrotestosterone, or DHT. So that is the main culprit for male pattern hair loss. It's a process called donor dominance. So if you think of somebody that has severe hair loss, but they have hair on the sides and back of their head, it's because of this donor dominance issue, in that these hairs do not have DHT receptors and the balding areas do. The same is true for beard, chest, and abdomen. There are no DHT receptors there. So when you move those follicles, even though the region has hair loss, it is a cellular issue. So when you move it, it keeps the same cellular expression or genetic expression, where it maintains not having the expression to interact with DHT. So this is a permanent move, which may over time, say decades, be affected with some thinning, which is kind of natural, but it is not affected by the main culprit for male pattern hair loss, or possibly female pattern hair loss in some individuals. If you're going through the process of figuring out whether hair transplantation is right for you, give us a call at 678-845-7521. You can reach us on the web at nahairrestoration.com. We're happy to help.